Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. The topic which we are going to discuss is psoriasis. So, psoriasis is a patchy discoloration of skin. So, basically, there will be discoloration on the skin in the form of patches. It normally occurs to the 1 or 2% of the population in their second or fourth decade. It means in their 20s or 40s. Though it occurs in all the ages, mostly we see in 20s and 40s. So basically, it's more than skin disease. It's an autoimmune disease. It is a systemic disorder. So that is a problem with this disease. So it is not confined to skin. It may attack your kidneys, or it may attack your thyroid glands, or it may attack your intestine or blood. Any other autoimmune disorder, you are prone. Autoimmune disorder means, so normally what happens if there is a bacteria or virus or protozoal infection from outside. So your body immune system has to react against it. In autoimmune disorders, what happens is, so your body will act against your body cells rather than acting against the outer cells or the pathogens. So this is the autoimmune disorder. The main problem with the psoriasis is it's a social stigma. So when someone sees patchy discoloration of your skin, so they are scared to touch you, or they are afraid to touch you. That's an embracing moment. Or even the own family members doesn't know that it is not a communicable disease. Though it doesn't communicate from one person to another person, it is purely a genetic disorder. Most of the people think that it may spread. That is the social stigma, even though it is non-infective. The one more thing is, mate value of a person will be decreased. What is mate value? If you think as a man or a woman sexually, you have a particular value. So this disease can reduce your mate value. It can lead to disruption of marriages or disruption of relationships. That is a main problem. So one more serious condition for this is, up to for about 10 to 20% of the patients, what happens is, within 10 years of getting the skin lesions, they may land into psoriatic arthritis. This psoriatic arthritis, sometimes it's simple, just pain in the small joints. It occurs in bigger joints as well, normally in the smaller joints. In serious form, the bone is completely degenerated. For example, if your finger is normally 5 or 6 centimeters, in serious cases all the bones will be degenerated and it comes to only 1 centimeter. So that serious it is in some of the patients if it is not treated in a long term or after 10 years. Basically, the functional disorders, it weakens you functionally and also psychologically. You may undergo depression, you may undergo frustration, or all the psychological disorders are seen because of. We look into symptoms and signs of psoriasis. So normally, sometimes, rarely, this psoriatic patches will be itching. So basically, these are erythematic patches. Erythematic means red color patches. These are well defined papules, plaques, or pustules. So what is a papule? Papule is a small lesion less than 5 millimeters of diameter, and it is an elevated lesion. Sometimes we see that type of lesions. Sometimes we see plaques. Plaque is a lesion around 2 centimeters in diameter, but it is not elevated. It is flat, but it is discolorated. Pustules is a blister kind of a lesion. If in some cases, psoriasis is expressed as pustules as well, where it seems to be a blister. So next stage, what happens is, you will find dry scales on the skin, on the lesions. Those are dry. These scales are loose, they are abundant. These are silvery white or micaceous means, so we know mica, right? It is one of the uh, classical features of psoriasis. It looks like mica. When you remove the scale, or when you shed the scale or scrap the scale, it becomes red, it becomes moist, and it may have micro bleedings.